guys, in this video we're going to be talking about the musculocutaneous nerve, its fate, where it starts and how it is ending, starting to ending of the musculocutaneous nerve. We're going to see about that. Musculocutaneous nerve. This musculocutaneous nerve is a branch from the lateral cord of your brachial plexus. This is your lateral cord. This is a lateral cord with this musculocutaneous nerve with the root value of C5, C6. The lateral cord has most of the root values C5 and C6, so musculocutaneous nerve has a root value of C5 and C6. Right. So this musculocutaneous nerve, I am going to use the red color for the nerve. You shouldn't be using this in the examination. I'm just using this because it gives more visibility here. This is your musculocutaneous nerve, a branch of the lateral cord of your brachial plexus. It pierces into this muscle called coracobrachialis. Coracobrachialis originates from your coracoid process and inserts into your arm. So it pierces into your muscle. It pierces into this coracobrachialis and comes out like this. You will see this, right? So see here as well. You see how this muscle, this is your coracobrachialis. This nerve pierces this coracobrachialis and comes out. This is your coracobrachialis. This pierces this muscle and comes out of this muscle at a region, and it straight goes like this. They give two branches. This is a nerve, not an artery. I am using this just because it is more clearly visible. Do not use red color in any case for representing any nerve. I am not following the color code. I am just using whatever colors that are available. Do not do whatever I am doing. See, muscle and all, I am just coloring because it is more clearly visible. Never use red color for nerve. Use always yellow color for nerves. Okay, so this is a musculocutaneous nerve more clearly. So this is a musculocutaneous nerve arising from the lateral cord. So let's talk about the branches. Now one branch is the nerve to coracobrachialis. See, it's supplying your it's piercing through this coracobrachialis muscle, right? So it also supplies branches to your coracobrachialis muscle. What is a coracobrachialis? Originates from the coracoid process and inserts into the humerus. Coracobrachialis, one branch. This is here. One branch of the musculocutaneous nerve is a branch to coracobrachialis. One. And another branch it provides to the brachialis muscle. This is your coracobrachialis. This is your brachialis muscle. Since it passes through along the brachialis muscle, it also provides nerves to your brachialis muscle. Branch to brachialis. Okay. The branch to coracobrachialis, branch to brachialis. These are the two branches. Now another branch it provides to the biceps. You might not be able to see biceps because biceps is present on top of this. This is your coracobrachialis and this is your brachialis, right? On top of this brachialis muscle you will have your biceps. You will see it more clearly here. So you see coracobrachialis coming here. This is your biceps. Behind the biceps only you have the brachialis. So what happens is this musculocutaneous nerve pierces the coracobrachialis and passes anterior to the brachialis and posterior to the biceps. It passes in between the biceps and the brachialis muscle. See, this nerve passes between the brachialis, between the deep brachialis and your superficial biceps. It passes in between them. So since it is passing between them, it gives branches to both your brachialis and to your biceps. Okay, so there are three branches. with me again. This is your branch to coracobrachialis, branch to brachialis, and your branch to biceps. These are the three muscles that are innervated by your musculocutaneous nerve in the arm. I hope you guys understood this part. Good. Now, after this nerve crosses this elbow joint, it branches off into two branches. This is your anterior lateral cutaneous nerve of forearm. This is your arm means this part, my thumb part, this part is my preaxial, that is my lateral part. So one branch of the musculocutaneous nerve branches off to give nerves to my skin, to my cutaneous part of my lateral part of my arm in the anterior aspect. I will repeat it. This musculocutaneous nerve, after it crosses your elbow joint, it gives a branch called the anterior means front, lateral side of your arm, cutaneous nerve of forearm. Cutaneous nerve means this nerve supplies the cutaneous part of your anterior lateral part of forearm. Anterior lateral part of forearm is the skin of the anterior lateral part of forearm is supplied by this nerve. Another branch, it goes towards your back side of your hand, and this is called your posterior lateral cutaneous nerve of arm. This is called your posterior lateral cutaneous nerve of forearm. In this diagram it might be more clear. So see here guys, so you see this is your musculocutaneous nerve. It gives a branch called your this is your anterior lateral cutaneous nerve of arm. So this is supplying your lateral part of your arm. This is supplying your lateral anterior part of your arm. So this is your anterior lateral cutaneous nerve of forearm. This is your anterior lateral cutaneous nerve. This is your anterior lateral cutaneous nerve of forearm. Okay, this is one branch. Another branch is it supplies your posterior aspect of your lateral cutaneous part. So this is your another branch. See this goes and winds around and supplies your skin of the posterior lateral aspect. This is your posterior, this is your lateral. So this is supplied by lateral cutaneous, posterior cutaneous nerve of forearm. See another branch. This is your lateral cutaneous nerve of forearm, which is a branch of your musculocutaneous nerve. Simply this side one branch, this side one branch. That's all. It supplies more your musculocutaneous nerve supplies your lateral aspect of your forearm, both anteriorly and posteriorly. That's all simple. Okay, so that's why it's called musculocutaneous nerve, because first it passes through these structures and all, and it becomes cutaneous as soon as it after the elbow joint. After the elbow joint, it becomes cutaneous. Till now it is deep. You have to understand that. Till now it is deep, passing through muscles like your coracobrachialis here, and passing in between the brachialis and the biceps, and as soon as it joins your elbow joint, it pierces the fascia and it supplies your lateral part of your forearm. You understand that? So I hope you understand this. I hope my video helps. This is a fate. If you wanted any diagrams, we'll make a Telegram group where we'll be sharing certain diagrams. So I hope you guys understood this video. Make sure you subscribe if you want. If you understood this video again, thank you. Peace.